Well, really something to think about with this pandemic. It has now been nearly 3 years since Oregon's very first confirmed COVID-19 case.
So that first known patient, you may remember this, was a Lake Oswego school janitor who spent 60 days on a ventilator. Well, today we're talking to a doctor that cared for him. Jenny Young reports.
Dr. Katie Scharf told me she is proud of the teamwork between hospital systems and public health that she says helped save countless lives during the darkest days of the pandemic. Dr. Katie Scharf remembers when Hector Calderon, Oregon's first COVID-19 patient, was admitted to the hospital on February 28, 2020. She says he worked at her son's elementary school.
A lot of conflicting emotions 3 years ago.
Scharf, the chief infectious disease physician at Kaiser Permanente Northwest, was the doctor who helped diagnose Calderon, something she didn't expect.
I was originally just seeing him to deliver a get well card from my son's first grade classroom, and then got involved in his care as a physician, as a medical professional, because things weren't making sense.
The patient spent 71 days in the hospital, 60 of them on a ventilator. President Joe Biden has said that on May 11th, he will end the COVID-19 national health emergency, nearly 3.5 years after it was first declared by former President Donald Trump's administration. I asked Dr. Scharf if she foresees any issues for patients once that emergency declaration ends.
The group of individuals I worry the most about are the uninsured, and the Biden administration has stated that they are working on a program to continue to provide free COVID-19 access and care for the uninsured. But those are some of our highest risk individuals.
Dr. Scharf says COVID will be with us for years, even decades to come. She tells me as researchers continuously track new variants, vaccines and prior infection continue to provide good protection.
I think for the time being, we can be reassured. I can't say with certainty that there won't be a variant that arises that completely evades, our immunity from prior disease or vaccination, but we have yet to see that.
According to OHA, there are still millions of people around the country dealing with long COVID, those long-term physical impacts of COVID-19. Kaiser Permanente has a clinic that is dedicated to caring for those patients. And I also found out that long COVID patients are protected under the Americans with Disabilities Act.